Good evening. Thank you for joining our live virtual community conversation about condom availability and sexual education in high schools in Montgomery County. Esta transmisión está disponible en español en el canal 33. I am Maria Navarro, Chief Academic Officer for Montgomery County Public Schools, and joining me tonight is Dr. Travis Gales, County Health Officer for the Department of Health and Human Services. Student health and wellness is critical to student achievement. As you may have read, Montgomery County has seen significant rise in sexually transmitted infections, or STIs, among community members ages 15 to 29. To address this emerging health crisis, the Board of Education recently voted for DHHS and MCPS to work together to make condoms and sexual health education available in all high school health rooms by October 1st of 2018. Tonight, we will be taking questions from students, parents, and community members about condom availability. We want to hear from you. You can submit a question by texting 724-990-8433 or by visiting our website at montgomeryschoolsmd.org. Thank you for joining us, Dr. Gales. We're going to go ahead and get started, and we will be taking some questions from the community. Sure. So I'll start with our very first question. We received a question. Some parents have asked why MCPS and Health and Human Services are making condoms and STI prevention education available to high school students. So talk to us a little bit about the data that HHS has and what prompted this work.
Sure. So first and foremost, thank you for the opportunity to be here with you all, and look forward to answering questions from parents and students and being able to provide information to help folks guide and make wise, smart health decisions and have good health outcomes. We certainly respect the fact that there are lots of folks with lots of differing opinions that are shaped by their own personal backgrounds, and we respect that. Also, we're tasked with making sure that we look out for the health of all the 1.1 million residents of Montgomery County. And to that end, we have been looking at the data trends over the last several years, and it's important to note that nationally, STIs are at an all-time high for the last several years, and that trend has carried down to the state, and particularly here in Montgomery County. And when we looked at the data, we noticed that for gonorrhea and chlamydia and syphilis as well, we were at highs for the last 10 years. And what was most notable about the data, for example, for chlamydia, overall there were approximately 4,000 cases in 2017, and within that, 67% of those cases were in females, and 27% of women with chlamydia in the county were 15 to 19-year-olds. Similarly, when we're looking at the male population, 14% of the cases of men with chlamydia in the county were 15 to 19. Now, when we look at gonorrhea overall, there is a slightly less amount of cases. It's only about 750 cases of gonorrhea. But when you break that down again, once again, when looking at female cases, there were approximately 32% of those cases were 15 to 19. And when looking at young men ages 15 to 19, 12% of those cases were 15 to 19. And so based upon that data, we recognize that overall we need to have some better strategies to address sexual health in the county because our rates for chlamydia increased double the state average, as well as the same for gonorrhea. And so as part of that comprehensive strategy, we wanted to identify the populations who seem to be at greatest risk based upon the numbers, identifying 15 to 19-year-olds being disproportionately impacted, and to come up with this comprehensive set of strategies that addressed trying to improve sexual health. So one component of that is offering access to condoms within schools. We know that's where young folk are, and present an opportunity to have conversations about education and outreach, as well as make provisions and access to condoms as part of that. But it's also a part of, again, a larger strategy that includes increasing access to screening opportunities so that individuals in the county, regardless of age, have an opportunity to know their status if they're developing symptoms or asymptomatic, and get the treatment that they need, because we know that when folks are screened properly and treated properly, that can also be beneficial in cutting down transmission.
Great. Our students have some questions as well, and I think with this piece around the data that you mentioned, we received another question. This came from an MCPS student who asked about what is considered a significant rise in STIs, and we've also been asked if the rise in STIs, what does that indicate? Can you talk a little bit more about that, specifically because you pointed out of the risk in youth between the ages of 15 and 19, and those are the students that we serve in our high schools?
Sure. So in the public health world, there's no magical number that determines if something is a crisis versus not. We take a lot of things into consideration. We look at the raw number. We look at the trends in terms of the increases from one year to the next. We also look at it in the concept of what's the baseline. So for example, if one case of Ebola happened in the county, that's an outbreak because that's not something we regularly see. But when it comes to STIs, again, we looked at the trend lines to see that it had been increasing significantly, and over the past year, the rates had doubled. Actually, for chlamydia, the rates had gone up 30% from the previous year. For gonorrhea, they had gone up 15% from the previous year. And each of those percent increases were double the increase in the state rates in terms of looking at both. What's also impactful in determining the fact that we called it an outbreak for young people in particular is that with sexual health, particularly for young women of reproductive age, untreated sexually transmitted infections can lead to complications such as pelvic inflammatory disease, which can lead to scarring of the fallopian tubes, which can impair a young woman's ability, or impair her fertility and her ability to have children later on in life.
So a lot of this information was also evident in the report that is on the HHS website. Specifically for our schools, we actually received quite a bit of questions from parents asking when students go to the health center, how will they receive condoms, and what is that process? Can you talk to our audience about what will that process look like? And it's important, I think, to note that the health centers at all of our high schools are staffed by staff members from the Department of Health and Human Services. And so that process is led by you in terms of giving guidance on what procedures to take. So speak more about that.
So you're right. So the staff for the school health and wellness centers are employees of the Department of Health and Human Services, particularly public health services, and they're staffed by, most of them are staffed by school nurses and a school health tech, and they provide a broad array of services for children and kids who utilize those spaces. Particularly as it relates to condom access, kids can come into the spaces and request to speak to the school nurse. They can say, I have questions about condoms, I'd like to get condoms, I have questions about sexual health. I may be experiencing some symptoms I'm concerned about and need to talk further about that. Or I just have questions and I'm curious to learn more about safer sex practices, abstinence, or sexual health in general. And so as part of that conversation, they'll meet with the school nurse, they'll engage in some conversation around safer sex practices, risk factors, share some of the data that I just mentioned in terms of knowing what the risks are out there, what the numbers look like, as well as here's a condom, here's what it looks like, here's how you actually use it properly to make sure that they are using it properly if they choose to do so. At the conclusion of that visit or that conversation, the condoms will be dispersed. Currently, they are in a brown paper bag. There are 5 condoms to a bag. They will be provided at no cost to the student, and that's, at least to begin with, that's the process that we're implementing.
Great. Actually, we got some questions from students, and I want to thank our community members and our students who are weighing in on several questions, because we did get this question around will they have to pay to receive this information, and how can they access the condoms in a safe way. And I think that's very important that you address those pieces. We've also gotten a question. Lisette, one of our parents, has asked if students who request condoms will be given instructions regarding exactly how to use them. And can you speak a little bit more about that piece of educating our youth around this?
Sure. As mentioned before, all of the staff who staff the school health and wellness centers, the school health centers, are trained in a broad variety of services and delivering services to children, and this sexual health is one of them. So as part of those conversations, there will be conversations about how to properly use them, how to store them, the risk, what happens if something happens with them, and so kids will be given guidance on how to properly use them.
These are latex condoms. What happens if there is a student that has an allergy to latex?
So certainly that happens, and currently the initial supply, we only have latex condoms, but we're working to make sure that we have provisions in place for students who may have that the latex allergy as an issue. So we're hoping to, soon after implementing the program across all of the centers, October 1, that we'll have some supply of non-latex condoms available. And in the interim, kids can let the nurse know, and we can help make sure that they get access to those.
So this piece around education also comes back to the school system. We've had several questions from parents about sexual health education in the classroom and what that entails, and I'm going to start with that because I think both of us approach this from an education perspective. So currently, students, part of the family life and human sexuality and disease prevention curriculum of our health curriculum supports knowing and understanding contraceptives, and specifically as students enter high school, there is more information in their health classes around condoms, and also enforces the concept of how to use them properly. And I think this is one of those pieces where we want to be able to have multiple places where youth can learn how to properly use condoms correctly. We've also had Karen, a parent, ask if female condoms will be available. Dr. Gales?
At the very beginning, no, but much like we're trying to make provisions and have a supply of the non-latex condoms, we're working to make sure that we have a supply of female condoms on hand as well.
Ethan, a student, has asked if you believe students will be too embarrassed or shy to go to a health room and obtain a condom. This is actually a very good question, Ethan. I'm glad you brought it up because part of this is the engagement with our youth. What do you are a pediatrician, what do you experience with youth and how they talk about this, how they approach adults about this topic?
Sure. So I want to say hi, Ethan. Thank you for your question. And you're right, as a pediatrician and actually a specialist in adolescent medicine and working with teenagers and young adults, talking about sex is not easy. It's not even easy for adults too. There's
absolutely
there's always some discomfort around it or some giggling behind it. And so the goal is we recognize that there may be some shyness or initial unease about utilizing the space. So that's why we're being very thoughtful about the type of messaging we have within the space, making sure that kids have a positive experience, because we know that word of mouth spreads, say, hey, I utilized the space. I had a comfortable interaction with the nurse staff. I had a comfortable conversation. I was able to ask the questions I needed to ask in a non-judgmental space and get the answers and information I needed. And so we recognize that, and we're working really hard to make sure that we do what we can to make it a comfortable experience and address some of that initial unease, that initial discomfort that students may have.
And I also, Ethan, want to thank you for this question, because I also want to address it from the school perspective. Although the school system is not involved with the condoms and so forth, our staff, every student should have a trusted adult in our schools. And I think it's just important to emphasize that our health teachers, our counselors, and our administrators have been very well made aware of the condom availability, and we want students to feel like if they have questions, they can also access these trusted adults and ask questions so that they too can support any referrals to the health room, but can also answer questions that students may have in just a lieu of topics. I want to, go ahead, I'm sorry, please.
To add to that, and I'm sorry for not including this. One of the other experiences that you often encounter with patients is they want to feel that it's a trusted environment and that their information is protected and confidential. And I want to emphasize that these encounters are treated like healthcare encounters, and so they are protected, considered private interactions between the student and the healthcare provider. And so we go to great lengths to make sure that we protect the student's privacy and work to make sure that they feel comfortable within the environment, that it is confidential, protected information.
Thank you. So I want to encourage everybody to text us. We are receiving questions from the community, parents, students, staff members. Remind us to text at 723-990-8433. The next question is from an MCPS parent who has raised concerns around the student's maturity around this issue. And we received also some similar emails commenting or asking about, are students mature enough to be talking and dealing with this topic? What do you say to that, Dr. Gales?
Well, in one aspect, what's really interesting is, without even discussing the maturity level about talking about it, we're finding that, self-reported data shows that over 40% of young folk are engaging in sex. And so we look at this as an opportunity to create educational outreach efforts that do take into consideration some of the developmental stages that adolescents and young adults are at, to make sure that the information that we're providing is age appropriate and developmentally appropriate so that they understand the risk factors and information we need to convey. It's also important to make sure that they have an understanding of the resources in the community that they need to make healthy choices and have healthy outcomes. And so we do think through those things, but the reality is there is a significant amount of young people engaging in sex, and when you look at the data in terms of the disease rates, it underscores our need to act, but it also underscores the need to make sure that when we do put interventions for this population, they do take into consideration all of those factors, and it's not just taking a model that we would use for adults and just making it fit for young folk. So some of the other efforts, again, it's not just about the condoms, but some of the other efforts we're looking to engage young people in how we think about healthcare and public health strategies, because we know that it's important to get their input in terms of what works as opposed to deciding what works for them and then implementing it. And so again, collectively, all of those things take into consideration that the developmental stages, but there are different realities that they face that may not be similar to what we encounter as adults.
We are a very diverse school system, both linguistically, culturally. I would imagine that information will be available in multiple languages for students, as we also make it available in the school system. How do you also support different cultural backgrounds and students' sort of knowledge as you approach this? I mean, you mentioned you approach this as any other health issue when you are talking to youth, but what have you also learned through your experiences around supporting different groups of students?
Well, I think one of the core fundamentals of being a physician is to just respect where people are when they come into the encounter. And part of that is working to affirm individuals and the choices that they make. So, as we're talking about providing condom access to students who may be sexually active and making sure that they have access to screening and treatment, those kinds of things. Certainly if an individual, a student said they are choosing to be abstinent, we would work to affirm them and their choice and help them, provide information to support them and affirm them in that way. So similarly in terms of thinking of different cultures and different backgrounds, as we grow and move forward in terms of our dissemination of information, it will be important to think about how we can engage different communities and have these conversations about, here are the numbers, have conversations about how sexual health is addressed and talked about within communities, because we do want to make sure that, again, in any practice of medicine or any delivery of any public health message, that we think through all of the different cultures and backgrounds and ideas, because we want to make sure that the information we release has an impact and resonates within different communities. And so that's some work we have to continue to do on our end, but it's one that we look forward to, and we look forward to engaging the community and figuring out how we can do that better and have more of an impact.
Thank you. We got a question from Brian. Brian, thanks for your question. As a parent, Brian has asked, who is funding this initiative? Tell us a little bit more about the funding structure.
Sure. So to get us off the ground and moving forward, because again, this has not been done before, we have provisions through our county sexual health program. We receive funding from the State Department of Health, including provisions for condoms. And so at least for the first several months getting started, we are utilizing that supply from the state to supply each of the school centers. And again, this is one piece of a larger comprehensive strategy that we're looking to put into place. And so part of that will be looking for additional funding that may be able to provide additional support. The cost of condoms isn't a huge cost. For example, some of the estimated prices for 1,000 condoms, it's about $90 for that whole supply. So we're looking at ways to grow, and particularly we had a conversation about non-latex condoms and female condoms. We're looking at strategies to be able to sustain the supply, but that meets the need of the program.
Thank you. This question is one that I've also heard come up. Sophia, one of our parents, is asking why parents cannot be notified if their student requests and receives condoms and Sti Prevention Education. Tell us a little bit about that. It's been a question that I've heard quite a bit from parents.
Right. I was going to say, Sophia, thank you for your question, because this is something that comes up often, both from an administrative standpoint and as a pediatrician have had numerous conversations with parents related to this, particularly as their kids age into the teenage and young adult years. So when we talk about young folk and sexual health, there are a full list of laws that have certain protections in place that allow for minor consent for certain things. It is actually one of the few things that all 50 states agree upon in terms of having protections in place for minors to be able to consent to certain aspects of sexual health care. Now, it's differences within what's approved, but all 50 states have some law in place to allow minors being 13 and older to be able to consent to some aspect of care. In the state of Maryland, the state regulations actually allow minors to consent to a number of procedures. One being they can consent to information seeking, screening, and treatment for sexually transmitted infections, such as the ones we talked about before. And then they also are protected for asking for information on and seeking access to contraception such as condoms. And those laws allow them to consent for that. They do not require parental notification or consent for that, which explains why we have the program in place without any type of parental notification system or consent system for that.
That's a good response, and I think it's important for parents to know what the Code of Maryland regulations say. I want to remind everybody that is tuning in that they can submit questions. Please go to montgomeryschools.md.org and you can submit questions live. Amy, a parent, would like to know why students can't buy condoms at the store. Why not just simply buy condoms? And this is a good question. As you mentioned, condoms are not very expensive, and so why can't they just get them at the regular pharmacy?
Well, I mean, they have the option to do so, but we want to. This is an important area where we want to remove barriers from being able to do that. So, kids may not be able to drive to stores or have access to stores or may not have the money to do it, in spite of the fact that they're not significantly expensive. We also are believers that, this is part of a comprehensive conversation, as we talked about. It's an opportunity to talk and answer questions and do some education and do some risk assessment and to empower kids with information so that they can make healthier, wiser decisions and have good outcomes. the literature has shown consistently, and I would encourage any parents with any questions about this, about looking at abstinence-only programs versus programs that allow for condoms and those types of things, comprehensive sexual health programs. The AAP, American Academy of Pediatrics statement, supports condoms in schools, and as part of their position statement, lays out different analyses of lots of different studies that have consistently shown that sexual health programs for teenagers and young adults that do incorporate condom access have had more success than abstinence-only programs in terms of delayed initiation of sexual activity, as well as lower rates of teenage pregnancy and sexually transmitted infection.
So to that point, I'm also curious if our parents are interested in getting more information, so they too can have the conversations with their children. Does the HHS website offer parents ways to begin those conversations? You've mentioned it a couple times, the importance of having the availability of adults and a trusted adult to be able to talk to youth about this topic. What's available? Where can parents go? You mentioned a couple of things. I want to reemphasize it for our viewing audience about what other resources exist out there.
Sure. So I think the biggest factor that influences that conversation is the relationship between the parent and the child. And you mentioned lots of different background factors and things like that. Those things shape the interpersonal dynamics and the relationships that are there before you bring in, me as a pediatrician or, you as an academic, and to influence that. And so I think that's the bedrock of that conversation. I think engaging the child's health provider in terms of initiating those conversations and having some discussions is important, because most times, particularly with pediatricians have had a long relationship with the child as well as the family, so there's a rapport there and a trust there that's built. I think in addition to that, when looking to more professional resources, the American Academy of Pediatrics has lots of literature on this. I think one, and having been a member of the AAP as well as the Society of Adolescent Health and Medicine, SAM has lots of resources as well that focus specifically on how to have conversations with teenagers, not just about sex, but about being a teenager and everything that comes with that.
Thank you. We got a question from Caitlin, a parent, that asks if there will also be accompanying signage or distributed materials about affirmative consent. So affirmative consent, I want to thank you for that question. Dr. Gales, can you talk a little bit about what the Maryland law just stipulated about what affirmative consent? I'm not sure if everybody that's tuning in knows exactly what affirmative consent is all about before we tackle this topic.
Sure. So the concept of affirmative consent, it's a very important topic. And I want to go back to one of the things we talked about earlier. This is, again, an area and an opportunity where, in engaging those conversations and creating that safe space, that students can talk about issues of consent and, interpersonal violence and those kinds of things. Because we want to make sure that if that is happening, that there's a venue that they can express that safely and be linked to the resources that they need to get the help that they need. And so this notion of affirmative consent is not just simply this idea of saying, no means no. It's actually affirming to having intercourse and being an active participant in what's happening. It's not just simply having to say no, but actually affirming your space there. And part of that is it's a deeper conversation, and there's lots more to it. And I think it's important to, I know we're talking about condom availability and things like that, but it's important to make sure that young folk feel affirmed in terms of their mind and their body if they are sexually active, and that it's happening and occurring in a safe environment where they feel safe, and they are affirming to it and not doing and that it's consensual and there's no issues around that.
I do think that we should note also that MCPS supports and works in tandem with the State Attorney's Office on the Choose Respect Conference. And it is an opportunity for young people to learn about consent, affirmative consent, to be able to discuss, and parents also to be able to discuss physical, sexual, and emotional abuse, dating violence, and prevention. And I just want to let our viewing public know that this year the Choose Respect Conference will be held on April 7th of this coming year of 2019. And so we hope that the engagement, the wonderful engagement that we've had for the past several years continues on. Coming back a little bit more to our topic at hand, we've gotten several questions from parents that have asked, what can they do if this conflicts with their religious beliefs?
Well, again, we respect the fact that there's a lot of diversity of beliefs and backgrounds and opinions related to this, and we respect that. But again, going back to the actual encounter for the child, this is a protected situation. I would say if parents have particular beliefs or concerns regarding their beliefs, that's a conversation that they can have with their child and the privacy of their home. But as it relates to, again, going back to the encounter within the health center, that's a protected conversation. And by law, that is protected information for the student.
So probing a little bit more on this, Robin just sent us a question. Thank you, Robin. She's a parent of an MCPS student or students, and is asking, what can parents or guardians request, can do, or can they request that their child not be provided condoms or STI prevention education? And one of the things that I'll start with this, with the latter part, which is our curriculum is based on Maryland COMAR, does have the topics around talking about sexually transmitted diseases and talking about condoms. So in the health curriculum, this is addressed, but I think more specifically, this parent may be asking, what if I as a parent don't want the health room to give my child condoms?
Well, again, to reiterate what the law states that this is protected information, and it allows for minor consent for these areas. And so the law is what it is, and clinical practice and policies are what they are, and that's what we follow. And again, we certainly respect every individual's beliefs and backgrounds, but when it comes to the delivery and purveyor of public health services, we follow what the law states. And this is a protected area that has provisions in place that allows for the student to be able to access these services.
Thank you. If you're just joining us, we are hosting a virtual learning community conversation about condom availability and education in MCPS high schools. I am Maria Navarro, the Chief Academic Officer for MCPS, and I'm joined by Dr. Travis Gales. And we are taking your questions. Please text questions live to 724-990-8433. You mentioned earlier, and I want to go back to sort of the long-term effects of fertility in females. I'm wondering if you can talk a little bit about what data we have on the implications of youth not really knowing about STIs and not knowing the preventions and how to do this. And what does that mean, especially for female and fertility issues?
Sure. So to take a little bit of a step back and do kind of a little bit of biology 101, so sexually transmitted infections, the two that have been significantly impacting and disproportionately impacting young folk that we've mentioned are gonorrhea and chlamydia. Mm-hmm. Both of those infections can come with symptoms. Oftentimes they are asymptomatic, so an individual, regardless of age, may not know that they have it. And so that underscores the need to make sure that people are being screened appropriately and treated as needed if they are symptomatic or asymptomatic. And so that on that level, we have to make sure that providers are educated in the community to know when and where to screen, and to make sure that they know what the most up-to-date screening modalities are and methods are, as well as the most up-to-date treatment. So with gonorrhea and chlamydia, both of them are treated on the spot. So chlamydia is treated with azithromycin, and azithromycin, it's one pill. You take it and it takes care of the infection. Gonorrhea is treated with dual therapy. It's treated with azithromycin and ceftriaxone, so it's a pill and a shot. And so sometimes it's possible that an individual may not clear the infection and may need additional treatment with those same medicines, but typically you get it, you're treated, and you clear it, and you move on, and you may potentially pick up the infection later. The challenge is if they go untreated, particularly for young women, the infection can spread to the fallopian tubes and cause what's called pelvic inflammatory disease. And in order to treat pelvic inflammatory disease, I've treated it as a pediatrician, it requires IV antibiotics, several weeks to month-long course of antibiotics to clear, but the damage and the inflammation to the fallopian tubes can cause significant scarring, which could impair a woman's ability to be get pregnant in the future. And so for young folk who have these infections, this underscores why we really, really want to be proactive about making sure that for those who do have the infections, that they are getting screened appropriately and getting treated, and to cut down on the risk that they encounter it at all and ever develop any of these infections. Because we want them to go on to have healthy lives, and should they choose to do so, have children in the future. And there are other complications as well. For example, again, unfortunately, young women tend to bear the brunt of some of these secondary consequences due to untreated STIs in comparison to young men. But for example, untreated gonorrhea and chlamydia can lead to a condition called Fitzhugh-Curtis syndrome, which is basically an inflammation of the outer layer of the liver, which requires significant treatment, hospitalization as well. So even though we, kind of think of these as trivial infections, they do have significant consequences if they go untreated.
Thank you. This is a good opportunity for just educating our youth and the public at large. I know that a lot of the resources that are available at the DHHS website also provide a lot more information and details to these topics. We received a question from a parent. Mesfin wants to know if by distributing condoms, we are telling our students it's okay to be sexually active. And I think this is a question and maybe a concern that parents have too. What message are we sending our youth? I'd like you to tackle this common question.
Sure. So I'll answer this in a couple different layers. So the first question, to go back to, again, we respect the fact that there are lots of different beliefs on this. On one side, we have folks who say we're promoting it's okay to be sexually active. There's another group of people saying we're not going far enough. So our task as public health officials is to make sure that we look at emerging public health problems or issues within our community, identify the folks who are being most impacted by it, and then use the full complement of our resources to help them clear things and help them rid that, and thereby making sure that the population is healthier overall. So we don't look at this from a moral lens or a subjective lens. We look at it from the lens of saying, here, identifying a problem and using the resources we have to fix it. And this happens to be a tricky area. It's a very sensitive area, again, given that there are lots of different beliefs. But from our perspective, we're not making an argument to say yay or nay, this is the right way to go. We see the fact that 4,000 cases of chlamydia in the county in 2017, and 25% of those are in 15 to 19-year-olds. So regardless of what we may believe, it's a problem that's already there, and we have to use our resources to fix it, because we don't want those numbers to continue to grow. And certainly we wouldn't want the situation where we have individuals who have it to go untreated and lead to some of the consequences that I just mentioned.
We're receiving more questions from our parents, and Blaine, thank you for texting your question, asked if condoms and STI prevention education will be available in middle schools, or is it just high schools? So the first thing I want to tackle is that students begin learning as part of their health curriculum in 7th grade about sexually transmitted infections. And in 8th grade, they go a lot deeper before they take their health class in 10th grade. But right now, I think we are beginning this work, or we're starting this work, and it is focused in the high schools. To that point, though, you mentioned ages 15 to 19. What other data is available for younger children?
Well, as far as the state data, that's the ages we're kind of limited to based upon the reporting. The youth, the YRBS study, the Youth Risk Behavior Survey, I've been using it for years, came out recently and has indicated that actually young folk are initiating sex a little bit earlier. And so, as you mentioned, it's important to have that as a part of the curriculum at earlier ages, to not just talking about sex, but to help make sure that young kids understand the need to be healthy and to adopt healthy behaviors, eating healthier, exercise, all those kind of things.
That's right.
Because it's a comprehensive thing. It's not just one item over here. It's your total self and your total body, your mind, body,
total wellness and health.
Right, exactly. And so it's important to initiate those conversations early and to continue those conversations as they get older. And so we want to also think about how we, again, work together in terms of making sure the curriculum does have age-appropriate information that addresses all of these things and helps kids, know the risk and know what the data shows. But we also are looking at other ways how to educate the broader community in having conversations related to sexual health. So, for example, before I came to Montgomery County last year, there wasn't a lot of conversation around sexual health, STI rates, things like that. We weren't talking about it. But when we looked at the data to show that the numbers are increasing significantly, we do need to engage in that conversation. And it's not just young people, it's everybody living in the county. So that we have an understanding that the rates are increasing, that may put, as a resident myself, may put all of us at risk of contracting something or coming into contact with it. So we have to be, smart and think about making the necessary choices to protect ourselves. And so I think as part of having that larger community conversation around sexual health in terms of what the data shows, but also in the context of a healthy total wellness approach, I think that will help drive how we start thinking about this in the context of what it means to engage in sex and what it means to talk about sex in ways that can be education-filled, can be respectful of individuals' cultural and religious beliefs, but also make sure that we get the information out.
Great. We've gotten a question as we think about the implementation of this particular body of work from the health department's perspective, as well as I'm sure for young adults there will be a lot more information. And as you mentioned, this is sort of a county-wide approach. Brian, who is an MCPS parent, texted us a question, has asked, how will the success of this initiative be measured?
So there are a lot of different ways, and the easiest way one would say is, well, you just naturally look at the numbers and see if they come down. Not so much, because within that, we want to encourage people to get screened more, and so when you screen more, you're inevitably probably going to encounter more cases. So the measures we're looking at is, one, we want to make sure that we talk to students who use the program to ask them, does this work? What works? What doesn't work? Did you have a positive experience? We certainly will keep track of how many condoms are distributed in the program. We are making sure that we do our due diligence in reaching out to other jurisdictions who have had these programs in place for a number of years or just starting to talk through what their best practices have been in terms of implementation and sustainability and making sure things are ongoing and potential expansion, and also to talk about what hasn't worked for them. And then within that conversation, we'll get a better understanding of how we can take those best practices or failed practices and what they may look like in terms of implementation in the county. We are taking a, some have said it's too measured of an approach in implementing this program. But again, we want to be very mindful that we build something that works for our jurisdiction, that meets the needs of our kids and our residents. And I know that may be a long-winded answer that didn't give specific metrics, but it shapes. I hope it gives Brian some information about how we're thinking about evaluating it moving forward.
So, Dr. Gales, do you foresee that as more of a conversation, not just from the youth perspective, but as a county, as people are more informed? Do you think that you're probably going to see a lot more people getting screened and thereby potentially maybe see an uptick before we see any type of decreases?
Well, it's hard to say. I mean, my goal is to, hopefully get more people out getting screened, not only, kind of on their own episodically, but also making sure when you go get your physical, you say, hey, I need to have that as part of my regular physical to normalize, getting screened and making sure that people know their statuses and get the treatment that they need should they test positive.
Thank you. So I want to thank everybody who has been tuning in and sending their questions. We greatly appreciate it, and we appreciate the time. I want to remind everybody that they can submit questions via MCPS website at montgomerycountyschoolsmd.org or by texting 724-990-8433. Amisha, a student, thank you, Amisha, for sending us your question, is asking how many condoms are students allowed to acquire within a time period? Probably a set of visits.
So there's no magical number. Again, at each visit within the bag that is distributed, there are 5 condoms that are in the bag. And, this really will be treated on a case-by-case basis. So, for example, someone coming in getting some every day, it really would be evaluated within a case-by-case basis, but there's no set limit to say, you can only get 10 every month or every 2 months, something. We currently don't have any, strict requirements in terms of that in place.
Right. Will students also will abstinence? Will students receive any information or education about abstinence when they come see a health provider in the health suite room?
Well, it's, again, the goal is to have a comprehensive conversation to make sure that we answer the questions they have. Again, abstinence is an option just as much as, having safer sex. And so our job is to discuss all of those different options with kids, provide them with the information that they need, answer their specific questions, and affirm them in whatever choice that they make.
Great. So I want to thank everybody who's been sending us information, questions, and we definitely want to be able to continue conversations with the community in general. If a student goes to the health room, to request a condom, will that visit be recorded?
Well, it will be recorded. So anytime a student accesses the health room, and so, there is maybe for the parents understand this, but for the kids, so I'm speaking directly to you so that you get an understanding of this, is that the visits get a certain code. So, if I go to the doctor for the flu, I may put in the code, here for acute illness for flu. If I go for a regular physical, there's a code for, regular annual physical. There will be a particular code used to kind of chart, conversation with school nurse related to sexual health that's kept within the electronic record. But again, I want to emphasize that record, like any other health record, is protected information, it's privileged information, and that is information that won't be shared with anyone else outside of the nurse and the student.
Will specific student names be kept in that record of the visit, or will you be keeping just a record of the visit?
We'll be keeping so the patient record will be what it is, and we'll keep a count of how many condoms are distributed overall.
We have more questions from our students. Catalina, a student, has asked why there was a recent spike in STIs in high school students that initiated this pilot program. This is a very good question. Thank you. How did this happen? I know that there's been a decrease in teen pregnancy, I believe, nationally. I'm not sure what the data says about Montgomery County, but this is a great question. How did this spike in STIs, what brought this about?
So I think it's multifaceted. I don't think there's one, and I want to make sure I explain there's not just one component to explain it away. I think that talking to patients over the years, there is so to take a step back, there's a national increase of STIs across the board too. So this is in the context, this isn't just in Montgomery County or Maryland, this is across the country. And some of the ideas that have been thrown out is that there is, while pregnancy rates have gone down, and I think in large part due to access to other contraceptive devices, birth control pills, long-acting contraceptives, things like that, that has cut down on our pregnancy rates. But within that, for some teens, I've had patients say this is like, well, my partner can't get pregnant, so we don't need to wear condoms. And so there is an uptick in condomless sex acts. So it could be due to, increased provisions of birth control. There is a fearlessness that comes with being a teenager, that, there's an invincibility. I'll be very candid, I grew up in the generation that was heavily impacted by HIV. And so during that time period, an HIV diagnosis meant a death diagnosis. Fortunately, we have been able to, with great, advances in medicine, have medications that allow individuals who are living with HIV to live a long life and their life expectancy not be influenced by having HIV. And so I think, younger generations have seen a little bit of that, and so there's less fear associated with sex than the generation I grew up in. I won't put us in the same generation. I won't age you within that. But so I think there's a reality of that. So I think there's also different ways in terms of how we're meeting folks as well. So I grew up pre-cell phone. So now, we've got lots of apps and other ways that makes it easier to connect with people. So we're just naturally interfacing with more folk than we did before. I think the education about some of these STIs has not been there in comparison to past generations, and I think this might be a big one. I tell the story, one of the first patients I delivered a diagnosis of HIV to was an 18-year-old young person who also was infected with syphilis. And when I delivered the diagnosis, they weren't fazed by HIV, but they didn't know anything about syphilis, and they couldn't understand, well, how did I get that, and where did that come from, and what is that, and that's so dirty, and I don't know anything about that. And I had to educate them that I was going to give them a shot, a penicillin shot that was going to take care of their syphilis, and it was gone, but it wasn't something that they had even thought about. They, only thought that HIV was the only STI out there, and, their knowledge level of gonorrhea and chlamydia was pretty low, and so they didn't know that that was something that they were at risk for. And so I think it's a constellation of a lot of these different factors that influence. It's important to know, and even this doesn't tie necessarily to conduct in the school, that sexual health budgets have been cut significantly during the last 10 years, and particularly in the last 5 years. And that has impaired particularly the local health department's ability to be able to respond, to do partner notification. We have disease intervention specialists who, that's their job, is to go out and a person comes in and tests positive for one, then to do the follow-up and to notify their partners who they have been with, who may have come into contact, their need to get screened and treated. And so, funds to support all of that have been cut, and that's impaired the health department's ability to be able to go out and do that kind of outreach. So again, it's a lot of different factors. It's not just one thing, but they've all added up to the fact that, again, for the third year in a row, we are at national all-time highs for gonorrhea, chlamydia, and syphilis. And in Montgomery County, we have seen the trends rise, and we are where we are in terms of the numbers this year.
And that question, that last response feeds well into the next question. Susan, a parent, asked why the process of putting condoms in school is moving so quickly. And I want to start this question, responding to this question, because the data that you just cited and that we've been citing throughout the program really led for the board, our Board of Education, to address and to acknowledge that this is a major health crisis for our youth. And in order to support the safety of our students, the overall safety, this was an area that our Board of Education agreed that needed to be supported. And so we are having different ways of communicating and hearing from the public and allowing the public to ask us questions, our students, our parents, our viewing audience. This is one of a couple of other opportunities where we will be out and speaking to the community around this topic. And I am sure that you also have an engagement plan at various places within the communities throughout Montgomery County to talk about this topic at not just the age that we're focusing on, but all residents of the county.
Yeah, the county has been doing sexual health for many, many years, and so we have a countywide sexual health program. And so in thinking about this comprehensive strategic plan, it's an expansion of that and looking at how we can, do some things differently and take some modern approaches to be able to address these issues. And so in terms of moving quickly, it's informed by the data, and I want to make sure that when we keep talking about data that people understand where we're getting the data from. So the data is collected at the state level. It's influenced by what we report from a local level up to the state to compile all of the information. So when we look at our numbers, we're able to compare how we perform against all the other counties within the state, as well as the state overall. And the numbers, it takes some time. So some folks have said, well, why did it take until the summertime to release the number? Is because the state epidemiologists are really, really methodical in terms of cleaning the data to make sure that when we release it, it's accurate. And I know that there have been a number of folks concerned that we were using aggregate data, so 13 to 29. We've broken it down with the specific age groups, and so the numbers that we've talked about tonight are really highlighting the 15 to 19-year-old age group. So we don't think of it as moving quickly. We just look at it as saying we have identified a problem that is brewing, and it's reached a critical point that necessitates our immediate action.
Catalina asked us yet another question. She asked if public schools in the county had any input in the decision to distribute condoms and if the program will be expanded to middle schools. So the program is not scheduled to be expanded to middle schools. We are starting and we're doing the work at the high school level. The lead agency is the health department, as this is a health issue. But we are working together to be able to reach multiple communities throughout Montgomery County so that our community members, our parents and our students can come and ask questions and can learn more about this particular initiative. So thank you for your questions. And I also wanted to just ask you about overall across the county, what are some of the other questions that you've also heard from youth that maybe didn't come up tonight that you may just want to highlight? Because I'm sure that I've seen you on TV a couple of times, so I'm sure that people are getting to know you as our health officer. What kind of questions are the youth coming to you and asking you?
I think the biggest one for young people goes back to one of the earlier questions, is this sense of embarrassment. Is this a safe space? Can I trust this space? And I want to make sure that young folk understand that we are doing what we can to make sure that this is a positive experience and that they can get the information they need. So again, from the spectrum of abstinence to safer sex methods, we want to make sure that our spaces are seen as safe spaces to have conversations, to answer the questions that they have, and provide them with the information that they need. And so we're looking at not only the school spaces, but also trying to think of other ways to engage young folk, teens and young adults across the county to be able to provide information and outreach, again, in ways that resonate with them, meet them where they are, and address their specific needs, not just us forecasting what they are and making sure they're a part of that decision.
So we are running a little bit out of time, and so we will need to wrap it up. I want to thank Dr. Gales for joining me tonight, and I want to thank everybody who has called in or emailed us questions. To learn more about condom availability in high schools, we invite you to visit the MCPS website at montgomeryschoolsmd.org and review the frequently asked questions and other resources we have provided there. Our comprehensive health education curriculum that outlines when students are introduced to the concept of STIs and contraceptives is also available on our website, and we encourage everybody to visit it. Finally, I want to remind our community that there will be an in-person community conversation about this topic next Thursday, October 4th at 7 p.m. here at the Carver Educational Services Center in Rockville. We will be providing language interpretation, and we want to thank you, the audience, for your questions and watching this virtual community conversation. Have a good night.